The following is an example of a patient encounter in the COMLEX USA Level 2 PE. The candidate's demeanor should not be construed to represent an ideal encounter with respect to doctor-patient communication, interpersonal skills, or professionalism. History questions asked and physical examination performed are not necessarily representative of superior performance. Any OMT performed in the encounter should not be assumed to be the most appropriate or only technique for the somatic dysfunction simulated. This video was created for the sole purpose of providing an example encounter as part of a tutorial for the purpose of familiarizing candidates with the eSOAP format.
You may begin your clinical encounter.
Come in.
Mr. Payne?
Yeah.
Hi. I'm student Dr. Hallstrom. Nice to meet you.
Hi.
Tell me what's going on today.
I'm having pains in my chest.
Okay. Is it okay if I take some notes while we talk?
Yeah.
Okay. Tell me when the pain started.
Started about a week ago.
Okay.
We were moving into our new home.
Okay. And where does it hurt?
It hurts on the right side of my chest.
Okay. And what were you doing at the time that you noticed it?
Nothing that I can think of.
Okay. Were you moving boxes that you said you were moving into your new home?
Yeah, I was moving some boxes.
Okay. But physical labor's not abnormal for you?
No, not really.
Okay. And what does it feel like?
It feels like a knife is sticking in me.
Okay. And does it move anywhere?
Sometimes it goes into my back.
Okay. Where in your back do you feel it?
Just like opposite on the other side. It goes right through.
Right through. Okay. Have you ever had this before?
No, it's never happened before.
And if you had to give me a number on a scale of 1 to 10, with 10 being the worst pain you've ever had in your life, where would this rate for you?
I guess it's 3 or 4.
3 or 4. Okay. And anything that you found that makes it better?
Hot shower, ibuprofen. Sometimes I can find a comfortable position lying down.
Lying down on your back or on your side?
Yeah,
Or?
yeah, on my left side.
Okay. Anything that seems to make it worse?
Lifting boxes, and if I take a deep breath in, that makes it worse.
Okay. Has this been interfering with your life?
Well, it's not very comfortable.
Okay. So I'm just going to ask you a few other questions associated with this. Did you have any sweating when this started?
No, I didn't have any sweating.
Okay. And any shortness of breath at all?
No, my breathing's been fine.
Okay. And have you noticed your heart fluttering at all?
No.
Okay. Did you have any trauma to the area?
No.
Okay. I'm going to ask you just some other general questions about your health history, if that's okay.
Yeah.
All right. Do you have any medical problems?
Sometimes I get a little heartburn, but this feels different.
Okay. And any surgeries in the past?
I had my tonsils out when I was a kid.
Okay. Do you take any medications?
I've just been taking ibuprofen for this, nothing
Okay.
else.
Any allergies?
No.
Okay. Anything that runs in your family?
My dad died of a heart attack when he was
Oh.
60.
Oh, so pretty young.
Yeah.
I'm sorry to hear that.
Thanks.
So I'm sure that that's weighing on your mind.
Yeah.
Okay. All right. Well, we'll be sure that we check that out. Okay?
Yeah.
And how about mom?
She's fine.
Okay. Any brothers or sisters?
No.
Okay. All right. And have you followed up with your doctor regularly?
I had a checkup like 2 years ago,
Okay.
and everything was fine.
Okay. Did they do blood tests at that time?
I'm not sure. I think so.
Okay. So something we should probably also do just in the future is check your cholesterol level and some of the other things that are risk factors for heart disease.
Yeah.
Okay? All right. Let me ask you just a few more questions. Do you smoke?
No, I've never smoked.
Excellent. And how about alcohol?
Occasionally I'll have a 6-pack on a weekend.
Okay. And how about any drug history?
I smoked some marijuana in high school, but nothing since then.
Okay. What do you do for work?
I'm a roofer.
Oh, so this is probably not feeling so great when you're on the roof working.
No.
Are you right-handed?
Yeah.
Okay.
Hey, Doc, you don't think this could be my heart, do you?
Obviously chest pain always makes us concerned about our heart. This isn't something that makes me think about your heart initially. Generally right-sided chest pain, I think more about it being something with your muscles. It is something that's in my mind that we should check into, but considering your age and the location of the pain, it's less likely. I'd like to ask you a few more questions and do a physical exam. But one of the things I'd also like to do, if you're okay with, is something called an EKG, which is it maps out the electrical conduction of your heart, and it's where we put the little stickies on your chest, and read that out, and then we can just make sure that there's nothing else going on. Okay?
Yeah.
Okay. I think I'm pretty done asking questions. I'm just going to wash my hands, and then if it's okay with you, I'll move on to doing a physical exam.
Yeah.
Okay, give me just a minute. If it's all right, I just want to untie your gown so I can take a look at your skin in the area
That's
where
fine.
you were having the pain, okay? All right. Show me again where the pain was.
It hurts on the right side of my chest.
Okay, so I'm going to just push around on your chest and you let me know where it is that it hurts, okay? I'm going to start away from the pain first and then I'll move closer to that area. Anything in here?
No, not so much.
How about up in here? No. But if I get down in there?
Yeah, like right in
Okay,
there.
right in there. All right. I'm going to take a listen to your heart while you have your gown down.
Yeah.
All right? Good, your heart sounds great. And I'm just going to take a listen to your lungs while you have your gown down.
Okay.
Some nice deep breaths in and out your mouth for me, please. Sorry, I know that hurts. Great, your lungs sound perfect too.
Okay.
And I'm just going to push on your back. Just let me know if anything hurts. Anything hurt right down the middle?
No, nothing there.
Okay, and I'm going to push on the sides. Any pain in there?
Yeah, right
Okay.
there.
Just on the right side or on the left side too?
No, just the right side.
Okay. And still pain?
Yeah, not so much down there.
Okay, so just right through here.
Yeah.
All right. Put your gown back up. Okay, so there's a few things that I think we probably could do. I do actually think that this is musculoskeletal, meaning that it has to do with your muscles and your bones, specifically your ribs, and not less likely that it's something that goes with your heart. I do think that something called osteopathic manipulation would actually be quite helpful for this. Do you know what that is?
No, I'm not sure.
Okay, so I'm actually a DO student, an osteopathic medical student. Osteopathic philosophy starts with the fact that the body is connected and we treat the body as a whole. As a part of our osteopathic education, we learn what's called osteopathic manipulative treatment, or we abbreviate it OMT. This is a series of hands-on techniques that we learn in order to treat pain or restriction in range of motion, in order to allow the body to heal itself and be more integrated as a unit again. Is that something that you'd be interested in doing?
Sure. Whatever helps.
Okay, let's give it a try and see how it goes.
Yeah.
I'm going to have you put your head at the end of the table here and your feet down the opposite end.
Sure.
And I'm just going to raise up the table a little bit, okay? Okay. I'm going to push around on the front of your chest just to find that spot again.
Okay.
Right in there?
Yeah.
Okay. And I'm going to push my hand underneath here, and we're going to see if we can find that spot in the back. Right in there?
Yeah, right there.
Okay. I know it's a little painful, I'm sorry.
It's okay.
And I'm just going to have you, so this is called balanced ligamentous tension. So it's a technique where I'm taking the rib on one side and the opposite side, and I'm compressing the rib together a little bit. I'm going to have you take a deep breath in just a moment, and that's just going to help us get the rib to release, okay?
Okay.
Okay, go ahead and take a nice deep breath in and hold that breath in. Sorry, I know that's uncomfortable. Go ahead and let your breath out. Great. And how does it feel now?
I think that feels a little better.
Great. Excellent. Take a deep breath one more time. A little bit better?
Yeah.
Great. Excellent. Okay, so I'm just going to lower the table, and you can go ahead and sit up. Great. And if you don't mind, just swinging back up to the front of the table here. So I actually think that that's a really good thing that we got a positive response with the OMT, that it did feel better. That makes me think even more so that this is more the muscles or the bones and not your heart. I understand why you're concerned about that. Obviously I would be because of your dad, and we should check into the other risk factors for heart disease. But I think that it's really unlikely. I think it's much more likely that it's the muscles and specifically your rib. So what I'd like to do, if it's okay with you, is I'd still like to do that EKG because that'll give us some information about how your heart looks right now. I'd like to check your cholesterol level because that also is a risk factor if it were high. It's a good thing that you don't smoke, and we'll follow up again in about a week or two, and we'll see kind of where you are as far as your risk factors go, and if there's anything that we need to do to help you modify those, we can. But I want to reassure you that I really think that this is more your muscles and your bones and not your heart.
Okay.
Okay?
Yeah.
Occasionally, when we do this, you'll still have some pain afterwards, and that's because the muscles are just a little sore from the bone being out of place. You can continue to take the ibuprofen if you need it, and obviously the hot showers or anything like that is fine. If you need the ibuprofen, that's fine. And then I would say if for some reason it comes back, if you have that sharp pain again, give us a call at the office and we can bring you back in and we'll do the treatment again. Occasionally it'll take more than one treatment for it to completely resolve. I'm hoping that it'll just be fine and you'll be okay to move on with your life. Okay?
Okay.
Do you have any questions for me?
No, I can't think of anything else right now.
Okay. It was nice meeting you, Mr. Payne.
Thank you.
Have a great day.
Thanks.